Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. This is the podcast that teaches compassionate communication, provides perspective, and inspires resilience. And today, we're going to cover a lot of those same categories with my guest, Jenn Johnson, RN. Jenn, thank you so much for being on the show with me.
No, thank you so much for making the time to see me.
I'm glad to do this. And so we could start at a lot of different places. I want to get to your book, Nursing Intuition, in just a moment, but you've been a nurse for how long now?
16 years.
16 years. And I understand
Yep.
emergency nursing is in there, something very close to my heart. So thank you for doing what you've done for these last 16 years.
Thank you. I'm going to guess you're probably one of the good ones. If you're
Well,
already so appreciative.
I hope I have been that patient who's been troublesome, and I don't desire to be that person anymore.
Fair
So
enough.
so thank you for doing what you do. And so one of the questions that I always ask my guests, and I thought this would be a good place for us to start with your 16 years of nursing experience. You probably have a lot to draw from, and whether it's through professional or personal life. But I want to start out by asking you that same question that I pose to every guest, which is if you can take a moment or two to describe a time that someone was there for you or that you have been there for somebody else. Is there anything that comes to mind?
Yeah, probably the one of the more recent ones. Had a young teenager come in, to the ER. It's a Friday night. He's drunk out of his skull and just, so drunk he's not really responding. And so we're like, okay, we kind of get the story. I decide to put on my very mean Nurse Ratchet hat and kind of give him the gears a little bit because, you're like 15, 16, 17, not supposed to be drinking and definitely not to this level. And so give him a gears for like an hour or two before he starts to wake up and the brother comes into the picture. And for some reason or another, we kind of get talking and the brother's giving him the gears better than I ever could. So kudos to this brother for like really laying into him. But the kid goes like, once he's finally alert enough to kind of really move around and everything, he's going, well, this is not a big problem. Like I've been drunker than this before. And for some reason or another, I decided to ask the question, what do you mean? And he goes, well, I get drunk like this like 2, 3, 4 times a week sometimes. I'm like, pardon me? Like, no, that's not right. And so I said, okay, well, how long's that been going on for? He goes, oh, about 6 months. And there was just something that screamed at me, and the question was out of my mouth before I could even really think about it. I said, what in the world happened 6 months ago? And this kid proceeds to then tell me that 6 months ago he witnessed a family member die in front of him in his home.
Oh.
And I'm going, oh, okay. Oh, this changes everything. All right. And so in talking to him, it's very much starting to sound like, he actually can't sleep without getting blackout drunk. Otherwise, he's having nightmares and intrusive thoughts and can't rest. And this is the only way he's figured out that he actually can get enough rest to be able to continue on the next day. And so I'm almost bawling because I'm like, oh man. And I come at this like Nurse Ratchet, like, oh, here we go. And so I'm looking at the brother. I'm like, did you know anything about this? He goes, he hasn't said one word about this the whole time. I said, okay. So, it's 6 a.m. I'm just about done. And yet this kid now has my full attention for the remaining hour. Absolutely. Everybody, all my other patients are okay and hanging on and doing what they need to be doing. Whereas now this is my priority. So in talking to him, it's like, okay, would you be interested in talking to somebody about this? Have you talked to your mom? Can you talk to your mom? Like what's happened? And this this kid is just like, if I need therapy, if I need medications, I've got a part-time job, I'll afford them myself. I don't want to burden my mom anymore than she already is. And I'm going, oh man, like talk about a trauma response of completely, not wanting to burden anybody else any further when he's very obviously struggling. So,
Wow.
talking to the brother, and the one of the few times where somebody's covered in puke and yet I'm still hugging them at 6 in the
Mm,
morning, and we're all crying together, and I'm like, look, at this is the one and only time that I've done this. Here's my personal cell phone number, and I need you to call or text if you need anything, knowing full well that just the way the kids, the way he's been talking, there's no way that he or his family are going to call me. They seem very, very large family, very close, but very, um, very private, very kind of blocked
stoic.
off. Yeah, very,
Yeah.
very stoic, horrendously stoic. And so, gave them my number. I went home and presumed he went home with his brother, and really just hoping that he um, got some help.
Yeah. Wow. And it just starts with actively listening,
Hmm.
right? Actively listening and hearing what other people are saying and how they're saying it. And uh, yeah, so wow, what a great story. And I hope he does get that help that he needs. So bring us into nursing intuition. How did this become your passion? And explain, I guess, for those novices of us like who are not nurses like me,
Hmm.
um, explain a little bit more about like what this is, what this looks like, and who you're trying to reach with your work.
Yeah, so truly, it just started out as a game. So when I had moved from Northern Ontario to Southern Ontario, going from a little ER that it was just me working the ER for 12 hours, and then you'd swap out with somebody else, and it was just one person in the ER, and only three nurses on the floor for about 14 beds. Um, Sometimes you wouldn't even see one person during the night shift. And so to that go from that and then come down south, and you're seeing 80, 90, 100 people in 12 hours, it's just like it was fun because that's what I was looking for. I was looking to really get my hands into it and keep busy, and I'm much better if I'm busy than like if I start sitting, it's hard for me to kind of get going again. So in all these, you know, shifts where it's person after person after person after person, and you're just going like, to try and keep yourself interested, you go, well, why don't I start guessing what people are coming in with? If somebody's grabbing their chest, well, that's pretty evident. They're going to come in with and complain of chest pain, or they're grabbing their stomach, or they're actively vomiting. Yeah, it's a pretty easy tell as to what's going on, or at least what one of the main complaints is going to be. But being able to then, like, the people who just don't look really well. So is it the color of their skin, as in sometimes you get very pale, you can kind of get a green tinge, you can be yellow from jaundice, you could be sweating profusely and really not have, it's not like you're coming outside from 100-degree weather. It's you've just walked 6 steps into the ER, and you're just drenched in sweat. That's, not the greatest of signs. And so trying to slowly figure out, who's sick, who's not sick, and who's really sick, but who doesn't look really sick. And so it just started out as this game, and the more I kind of played into it and used it, the more I was like, oh, like this person, I don't know what's going on with this person. Their story, isn't really raising a lot of red flags. Their vitals are okay. They're not great, but they're not awful. You know, they're not complaining of anything major, but there's something about how they're sitting in front of me, how I'm perceiving them. And it's just this like feeling in the pit of your stomach going, something's not right. Something more is coming down the pipes. We need to kind of get on this. And so here in Canada, we've got a lot of leeway with starting blood work early, doing some pain medications early or anti-nausea medications early, giving some fluid, or even some x-rays, depending on where it is. And so we can get a lot of things started before you even see the doctor, which is great, because that way, by the time the doc sees you, he or she has already got hopefully a ton of answers for you already. And so, looking at these patients, and you're like, I just want to add this one random test that, we don't really order much in the ER, but for some reason, like, that's what I want to see. And sure enough, you'd get this story where somebody's been laying on their floor, and EMS is telling you, oh, it's only been a few hours. But in reality, we don't know. Nobody else is in the home with them. We don't know how long they've been on the floor for. They weren't able to crawl to a phone or anything like that. And so let's do a creatine kinase, a CK, which is an indication of like muscle breakdown. And the elderly population, if you're laying on the floor for multiple hours to a day and a half, you can have huge muscle breakdown in a very short period of time. The problem with that is that little CK molecule gets all bound up in your kidneys and can do some really awful damage if not really flushed out well. And then, you come in with one issue and we haven't caught this other issue. And now that's the main concern, because now all of a sudden we're losing kidney function. So, would every now and again tack on a CK or, a lactate, which is kind of an indication of dehydration. And these things would be off the charts. And you're going, well, but why did I do that? What led me to get there? And yes, absolutely. Some of it is assessment and experience and knowledge. But then there's just those moments where, you're walking through the hall and you pass by a patient and your body stops. You literally stop mid step to look at this patient going, what is happening here? What is going on? I know nothing about this patient, but there is something that is stopping me. And me being me, I'm just going to stick my nose in it because I can. um, but I'm curious. I want to make sure that we're doing everything that we possibly can for this patient, that we're not missing anything. And if potentially other nurses are maybe a little bit too shy to go to the doc just yet, or they're just not sure, they don't have the background to kind of be able to very confidently go to a doctor and say, I don't know what's happening, but something's happening and I need you to see this patient. And so it's developing that skill and that trust in yourself and your knowledge and your skills and abilities, and then trusting when your body tells you that something is off. The easiest way to explain it is every woman, if not, in the recent time, if not, within the last couple of years, we've all got an instance where we've gone into a room or we've been walking by ourselves and we just get that immediate creep factor about somebody. And it's just this, thing that we've been kind of programming our whole lives from a very young age to just be very self-aware of who's around us, what's going on, because we all know that we're at a disadvantage. So it's a way to kind of, your gut starts screaming at you. And 99% of us, when your gut's screaming at you and you hear it, you go, nope, I'm out. I don't care what the situation is. I don't care what this guy's doing. I don't know what's happening, but I'm not supposed to be here. I'm not supposed to be in this situation, and I need to get out. So again, with nursing being predominantly female, thankfully more males are coming in. It's a very easy way to then take that feeling and recognize that feeling as then something's wrong in the scenario. It's no longer with me, but it's with my patient. So now it's this feeling that, something's just not right. And I can't put my finger on it. I can't give the doctor super solid evidence as to, it's their heart rate or it's their blood pressure or it's the look of them. Like, it's just, if I go to my docs and I say, hey, I've seen the lady in two, something's up. Here's her story. Here's the vitals. I need you to come and see this lady sooner rather than later, please and thank you, because there's more to the story that we are missing, and I don't want to get caught with my pants down. And I definitely do not want the patient to have a bad outcome. So it's taken a long time to be able to get to the point where you can go to your docs and say very confidently, I don't know. Like, it's just, I have this gut feeling, and framing it in that kind of manner where it's, I just don't know. I need somebody else's expert opinion. I'm just not sure. And the docs, my ER docs who are phenomenal and have been working with me for years and years, I don't do this lightly. I don't do it every shift. Sometimes it's only once every couple of shifts that I'm doing it, but I'm right fairly often. And, the science behind it, the difference between insight and intuition, it's just a little bit of a tweak as to how you're paying attention to it. So when you kind of get that, ping or that feeling or that, question that pops up into your head, are you going with it? Or are you just kind of, oh, no, that's silly. I don't know. Like, I'm just new to nursing. I don't know what I'm doing. Like, it's fine. And you brush it off. When in reality, after having that several times and having then potentially bad outcomes, you go, oh, I did feel like there was something that I was missing. And you kind of get down on yourself and you relive that case over and over and over and over in your head until you come to kind of the point where you go, I did feel like there was something off, but I didn't say anything. And I feel very bad for not saying anything. But maybe next time when something like that happens, I can listen to it. And, you know, to try and teach it to those who are newer to nursing or newer to especially critical care. So the science is that critical care nurses, so ICU, ER, they tend to trust their intuition more because they just don't actually have the time to second guess. They don't have that time to say, well, I don't know. They just have the feeling and they go with it because time is of the essence. So you end up honing this skill without realizing that you're doing it. But yet, when you start talking to coworkers, everybody says the same thing. Oh yeah, like I've had feelings like that. Oh, I trust my gut. Oh, I thought about that and I wasn't sure, but I didn't bring it up to anybody. And so now with so much science behind not just intuition, but specifically intuition in nursing, it's time we bring it forward and start not only just talking about it, but like honing it a little bit and realizing that it's another skill. It's another skill that can be honed, and it's something that is going to take time and effort to kind of utilize as best as we can. But learning how to do it is scary. You don't want to put yourself out there. Again, the science says that even if you're wrong, but you get your doc to come and assess your patient at that moment, just by having the doctor come and reassess, just that outcome, just that interaction.
Reassurance. Yeah.
Well, it's the science is actually saying that there's with that interaction, the patient outcomes actually improve. So even if you're wrong, maybe you're just new to it, you're a little bit anxious and you're a little bit overly cautious, you're still benefiting your patient and you're still learning how to advocate. So why not?
Yeah, that's so great. As you're talking through some of these things, I keep reflecting on Malcolm Gladwell's book Blink, and my wife and I, both read that when we were dating, and we still refer to, what's your blink on this situation? What's your gut say? What's your intuition say?
Hmm.
And I trust hers a lot more than my own. Um, Not just because of the inability to see, but just because of her sensitivity to many, many, many things like this. I trust my wife implicitly.
Hmm.
So thank you for now. Now I want to bring us back to nursing a little bit, though.
Yeah.
The We always are hearing about burnout and compassion fatigue in nursing. How does intuition play into that or the prevention thereof?
Yeah, so great question. So think about it. You have this patient who is pretty critical. Things are happening. You're already worried and stressed out and anxious. And then you kind of get this ping where it's like, okay, there's more going on. So what happens if you were to trust the ping, go to your doc, have them reassess, have them do some things where, you stop whatever outcome is happening and you change the course and we pivot and we actually start to get better versus getting worse. That nurse then doesn't have that's one less traumatic thing that you have to deal with versus, in B scenario, that same nurse just isn't able or there enough to be able to say like I don't know, continues on nursing as she is. The doc doesn't reassess, the patient continues to get worse. Heaven forbid there's a really bad outcome. Even worse, heaven forbid somebody sue. or there's repercussions or an investigation or something like super heavy where you're taking this brand new nurse who's already shaking out of their skin, and then you put them into these high pressure scenarios of legalities and being held really accountable for the level of their work without maybe potentially being really supported before that. you know so these two nurses are totally different over this one scenario. One has learned. It's still a very hard, rough job, but they've learned and they've avoided disaster, versus the other nurse who now has got this horrific experience and outcome and now has to deal with the mental load of that, right? Like, and carrying around the questions of guilt and, did I do enough? Did I act fast enough? Did I give the right medications? Should I have done something different? Like, those questions are the things that really linger and really over time erode your confidence truly. So it takes a lot of time to be able to get over those kinds of questions, but that's if you're sticking in the profession. If you're, at 1 year, 2 year, you've had one or two instances already that really rocked your boat, and you're already questioning, is this right for me? Am I in the right spot? I don't know. And now you're being knocked down again. The chances of that person not just leaving that job, but leaving the profession is huge. So why not prevent the harm on the nurse by preventing the harm on the patient?
And so, how do we encourage nurses then to listen to their guts? How do we encourage them? Because I feel like so many times, oh, I just had a feeling is not enough to change our actions
Hmm.
necessarily. Uh, but how do we get to where we trust our gut more, and then we're more comfortable advocating for those patients?
Talk to your peers. Honestly,
Mm,
your peers are your greatest resource. And I'm really hoping people are surrounded by at least one person who they trust to go to if, you're kind of having a brain fart and you're forgetting about, like, it's 3 in the morning. You're going like, oh, what was the average value of like potassium again? Like, I'm completely blanking. Those people who you can bounce questions off of without any sort of like, oh my God, really? Like, oh, you're so dumb kind of responses back. So if we just start talking about it and opening up, because right now it's a very, quote unquote, woo woo conversation that we all have been having for decades, but nobody wants to bring it forward because before we didn't have the science. Now
right.
we have the science. And goodness knows, I couldn't put out this book without the science behind me. The chances of me getting lambasted to start is going to be interesting. But, if we just bring the conversation a little bit forward, be a little bit more open with what we're feeling and how we're interpreting things, and being able to have the support to be able to ask questions about our patients. It takes nothing for you to go to the charge nurse, be like, hey, I'm just not sure about, Mr. XYZ. Can you just come and take a peek and see if I'm missing anything? To have that kind of support is absolutely invaluable, because chances are you're already onto something. They may not be as sick as you think they are, but the charge nurse can come back, they'll do a once over, and then you can sit down and talk about why you're having these feelings. Like, hey, what do you think is wrong? Why are you thinking this way? And let's not diminish this. Let's actually like lean into it and really support it and bring it forward. So all I'm trying to do is just bring the conversation forward. Like, thankfully I had one professor in university, one, who said, trust your gut, one time in university. And that was 16 years ago. you
Mm.
know, Thank goodness that person said that, because when I finally started to kind of lean into it, and instead of thinking, oh my God, I'm nuts, like this is crazy, what am I doing? This, who's teaching this? Where's the science behind it? I already had that voice in the back of my head going, but I had a university professor tell me to trust my gut. So it must have some weight if it's being taught in university. And thank goodness she said that, because who knows if I would have followed through? Who knows if I would have, done what I'm doing, or written the book in the first place?
So let's go to the book. Ideal reader, nurses,
Yes.
right?
Yep.
Especially early career nurses.
Mm-hmm.
Uh, I can't wait to get a hold of it just because I want to read the science. I am not up on this science, so I'm really looking forward to reading that. How can people get a hold of the book?
Yeah, so right now it's on pre-order on Amazon for the ebook. Release date for paperback and hardcover is October 29th. Um,
Okay.
it's been 2.5 years of waiting to get this out, and I want to say out and about, and people are going to laugh at the Canadian accent. It's been
Carry
two and
on.
a carry on, just a squirrel, right? You're just like off to the left. So it's been 2.5 years. I was supposed to be traditionally published. Unfortunately, about 3-4 months ago, my traditional publisher backed out and said, you know what, we're actually going to go back to our physiotherapy book base. And again, left me kind of in a tailspin to be like, now what do I do? And so I'm like, you know what? It's been 2.5 years. I'm putting it out. We're doing it. It's happening. And everything is
Mhm.
happening very, very quickly. And I'm kind of very nervous because the book started out as a trauma journal for my kids for COVID. Like, had I passed on with COVID, it was supposed to be good stories for them about why mom chose to continue to nurse during that time. And this is what it's morphed into. So it's my baby, it's my heart and soul. And if I ever need a new therapist, I just give them the book and goes, here's volume one. Why I am the way I am. Read at your leisure, and you can, come back to me once you're done, and we can save a lot of hours of talk therapy here.
That's great. Where can people learn more information other than getting the book through Amazon?
Yeah, so you can find me at RX for Growth, so prescriptionforgrowth.com. My Amazon page, Jennifer A. Johnson, RN. You can find the book there as well as a bunch of journals that I've come up with, kind of talking about grief and death and nurse wellness, and very much geared obviously towards the nurses. You can find me on LinkedIn if you ever need to just vent or need a supportive hand, or saying like, hey, I don't know, what do you think? Hit me up on LinkedIn, Jennifer Johnson, BSCN RN. Do not come for me. There are a million Jennifer Johnsons. So
True.
this is what I had to do. I'm sorry. We all laugh. It's an inside joke that everybody uses their like entire credentials, and it's ridiculous. You can find me on TikTok and Instagram at ernurse.jen, Jenn. And again,
Okay.
it's just a place to kind of decompress. And TikTok's kind of the funny, goofy side of, just stupid stuff that we all need to laugh. So why not just like throw it all up on TikTok and see where she goes?
Good, good. I'm looking forward to checking that out too, because I like things that are all over the place. So
Oh, nothing is more all over the place than an ER nurse, let me tell you. All of us
an ER nurse
undiagnosed.
on TikTok.
Oh man, all of us are, the joke is that we're all undiagnosed ADHDers and elder
Mm.
millennials and all this kind of stuff. So if you find yourself on the nursing side of TikTok, it is some interesting stuff. I will pre-warn you, but like it's us being funny, because if we're not laughing, we're just crying. So this is our very dark way of trying to cope.
Well, and you're giving people tools for coping through the journaling. That kind of comes into my area of expertise with the narrative medicine part. That how do we cope with this very, very difficult profession that everyone in healthcare finds themselves in? Whether you're nurse at the bedside or you're EVS for that
Yeah.
matter, you're
Yep.
still interacting with terribly sick and injured patients every day. And how do we come back from that to live another day, to fight again, to take on another shift without that weighing us down so much? And I look forward to hearing some of your tips for how to do so in the book.
Well, and if you've got tips on the science, 1,000% will take them, because, like, again, I'm probably going to get lambasted. So I'm any support on the science bit. Obviously with the book, trying to be a good nurse, I kept to most recent 5 years. The whole scholarly article back to essay writing in, in university. So Any help would always be appreciated.
Well, sure, and congratulations too. This is your
Thank you.
first book that you've written.
This is my baby.
Yeah,
The second one, the second one's kind of already teed up, ready to go, just because I wrote it as I was waiting for this one to be published. So Nursing Power is teed up, ready to rock and roll, and I'm just kind of debating as to when we bring her out behind Nursing Intuition, because Nursing Intuition needs her moment. She's waited a long time.
yeah. Good stuff. Good stuff. Okay, so for my last question for you
Yeah.
then is let's say, and this is a question that I pose to almost all of my guests. Let's say you have the world's largest billboard on the tallest mountain on earth.
Mhm.
What is the message that you want to broadcast to humanity?
Either just be nice. It's a very Canadian concept. Either that or put yourself in that person's shoes, because
Mm,
everybody's got trauma that we know absolutely nothing about. We know what 1% of that person in our interactions. We could know somebody for years and have nothing on what they think about on a day-to-day basis. So being able to grow your own empathy for others and put yourself in others' shoes is, especially in the ER setting, absolutely would be life changing. Not just for me, but for my patients who are struggling. And, you know, it's always those who are not nearly the sickest who have the loudest voices. And unfortunately, it really takes a toll on the nurses as well as all the other staff. But it takes a toll on the people who are really sick and who just want to sleep and recover, and they've been stuck in the ER for 100+ hours waiting for a medical bed. um, just maybe take a look around, open your eyes just a little bit and see what the heck is going on around you, because it's not like the ER is quiet. I bet you know more, just as much about that patient as I do, if not more, because you've been there for potentially 12 hours already. When we're resuscitating people, you can feel the difference in the air when something absolutely tragic and traumatic has happened. Please just be aware that we are expected to see the worst of the worst and then slap on a smile and come into your room. So just be a little nicer, please. That would be
yeah.
lovely.
I need a warm blanket. I think
Ugh,
the nurse needs the warm blanket after what
nurse.
they've just witnessed. Yes.
Oh, and it's like, we get it. We absolutely understand. It's very cold in hospitals for very good reasons, sterility, blah, 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 the whole bit.
Mm,
But it's cold. You're not moving. The bed is cold. The mattress is thin. So you're picking up, all the cool air underneath it. So the cold air is coming at you from all angles. We understand. We do have limits on to like how much laundry we can actually access in a day. So if I'm giving you 16 warm blankets and you're just asking for more, and then, tossing aside the ones that are no longer warm, that's still laundry that has to be done. That's still taking a blanket away from somebody else. So please just,
yeah.
we get it. You're uncomfortable, you're in pain, you're suffering, you're scared, you're not sure what's going to go on next. And Google has told you the absolute worst. um, like, we get it. You're scared, and we can justify a lot of behavior, but there's some behavior that you can't justify. And screaming at me is and spitting at me is not a behavior that we can justify.
I guess I would have thought things were nicer in Canada, but you're telling me you're dealing with the same issues as I'm hearing from a lot of nurses in the US too.
Oh, it's just people, right? Anybody
Yeah,
who
it's
works with
just
people,
people.
whether it's healthcare or not. I used to work in customer service at Canadian Tire, the most Canadian job you could possibly get. And it's still people. Like, I knew that people had this in them before even getting into nursing, before even getting into university. I knew that they had this kind of streak in them if they're not getting their way, like, let alone
Right.
adding on pain, stress, anxiety, fear. So it's just kind of amplified in the ER, but we excuse a lot of behavior. But if your nurse is saying like, "Hey, that's not acceptable," you have absolutely crossed the threshold, and you better smarten up.
Mm, mm. Yeah, we could do a whole episode on that. Well, Jenn Johnson, RN, thank you, author of Nursing Intuition and rxforgrowth.com, I believe you said.
Yep. Yep.
Um, Thank you so much for spending some time with me today. I really appreciate that. And good luck to you on the book release. Congratulations, too.
Thank you. Thank you. Thank you so much for making the time for me. It's just so appreciated.
Oh, appreciate you too. So, and thank you, listeners, for being with us on this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and please reach out via marcusengel.com for keynote speaking needs, healthcare consulting, books, etc., etc. Thank you all so much for being here.